So we'll now shift gears and I'll provide an update on our vaccine rollout and milestones reached to date. Next slide. On May the 5th, Health Canada authorized the use of the Pfizer-BioNTech COVID-19 vaccine in youth aged 12 to 15. This is the first COVID-19 vaccine authorized in Canada for use in youth. This is great news for us in our vaccination effort. On May the 17th, the province announced that youth aged 12 to 17 will be eligible to book an appointment through the provincial booking system beginning the week of May the 31st. The provincial plan targets completion of both doses for this age group by the end of August, coinciding with the start of the next school year. In Halton, we estimate the 12 to 17-year-old population to be approximately 53,000 individuals. Residents aged 16 and 17 years of age who have already booked their first dose appointment as part of an existing eligible group may need to have their second dose appointment changed to be scheduled by the end of August. We are planning to reschedule their second dose appointments and will communicate these details to them. Staff are working to determine the best way to roll out the youth vaccination program in Halton, including clinic locations, when the booking system will be updated to offer appointments for all 12 to 17-year-olds, and the process for rebooking second doses for 16 and 17-year-olds who have already booked their appointments. We are working closely with our school board partners to ensure we have their perspective in our plans. In fact, I just met with our school board superintendents just prior to this council meeting. We will provide council and the public with more information as specifics are confirmed over the course of the next week. Next slide, please. As you know, last week, the province paused the use of AstraZeneca vaccine. The decision was made out of an abundance of caution due to the increasing reports of the rare blood clotting condition known as vaccine-induced immune thrombotic thrombocytopenia, or VIT. Recent data indicates that the rate of VIT in Ontario is now estimated to occur in approximately 1 in 60,000 doses administered. Residents who have received their first dose of AstraZeneca have protected themselves and the community. Our surveillance system is working well and monitoring the safety of vaccines. AstraZeneca has been used successfully in the UK, where the B.1.1.7 variant was first identified, and data from the UK indicates that there is significantly reduced risk in blood clotting amongst those who received a second dose. We are looking forward to hearing more guidance from the province and from the National Advisory Committee on Immunizations about second doses for those who have received their first dose of AstraZeneca. As more information becomes available, I will continue to update our community. Next slide, please. The province expanded use of the Pfizer and Moderna vaccines to pharmacies in hotspot areas the week of May the 10th. As shown on the provincial webpage that lists pharmacy locations in Halton, we have over 30 pharmacies in Halton offering either Pfizer or Moderna vaccine to all eligible Halton residents. This includes all those aged 18 and older. At this time, there is one pharmacy listed in Oakville that offers the vaccine 24 hours a day, 7 days a week. Over the last 2 months, we have been building capacity within our primary care clinics throughout the region to have them offer vaccine to their patients. Many were able to offer AstraZeneca when it was available for first doses. Many clinics are in various stages of getting ready to receive vaccine. At this time, only Moderna vaccine will be offered in select primary care settings. This is being rolled out over the next 2 weeks, and we expect that both pharmacies and primary care will play a significantly larger role in vaccinating future eligible populations, as well as vaccinating with possible future booster doses. Next slide, please. Ontario's vaccine rollout continues to pick up speed, and with it, there are a few updates I'd like to share. Ontario began offering vaccine bookings for all age groups 18 years of age and older on May the 18th. As per our plans from 2 weeks ago, Halton did the same, opening up to this group earlier this morning. As of 8 a.m., 4,000 additional residents had booked their vaccine appointments with this latest launch in eligibility. There are several groups now eligible for an earlier second dose in Ontario. These are listed on our website. According to the province, these groups face a greater risk of contracting and suffering serious illness from COVID-19. Residents currently cannot reschedule their second dose appointments through the Halton booking system. However, this functionality is being worked on, and I will provide an update on the booking system shortly. I would like to note that while some groups are eligible to receive their second dose sooner than 16 weeks, recent research shows that the first doses offers 60 to 80% effectiveness in reducing your chances of getting COVID-19 and 80% effectiveness against hospitalizations. First doses aim to induce a memory response by your immune system. This can take some time to develop and mature, thus making an extended interval just as good as, if not better than, the recommended interval. In fact, very recent evidence from the UK shows that seniors who got this extended dose interval mounted a better immune response than those who had a shorter interval, with antibody levels 3.5 times or more higher than their counterparts. As I noted in previous presentations, our experience with vaccines over the course of many decades shows that this is often true with many vaccines, and immunity after the first dose not only mounts over time, but also does not wane quickly, making our strategy in Ontario and other provinces in Canada a good one. Lastly, the province will be launching a Roll Up Your Sleeve campaign, which locally will be promoted as Roll Up Your Sleeve Halton. The purpose is to encourage everyone who is eligible for a vaccine to book an appointment. Next slide, please. In early May, Halton and the rest of the province began transitioning into phase 3 of the province's 3-phased vaccination plan. This means we are much closer to getting first doses in all adult arms. When we last presented to Council a month ago, vaccine eligibility was limited to certain ages and to certain phase 1 and phase 2 populations. Since then, we opened up community appointment bookings for workers who cannot work from home. This was done in rapid succession by age, from 50 years of age and older on May the 3rd, all the way down to 16 years of age and older on May the 10th. This approach was mirrored shortly thereafter by age only, with no restrictions, up to age 18 years of age and older today. We prioritize people who could not work from home based on our local data showing higher infection rates at workplaces and a higher risk of death among older adult groups. Opening appointments for those who work outside the home, beginning with the oldest populations, was intended to reduce transmission, severe illness, and death, getting us closer to achieving community-level protection. I'm very happy to say, as of today, all Halton residents age 18 and over are eligible to book an appointment for a COVID-19 vaccine. And of course, we know that the 12 to 17-year-olds will be next in line. Next slide, please. We're continually improving the functionality of our online booking system. I would like to highlight a few changes slated for later this week. As of Friday, May the 21st, individuals will have the ability to schedule or reschedule second dose appointments only in our system, provided that they receive their first dose in Ontario. Following provincial direction, the system will also allow additional cohorts to receive their second dose earlier than the extended 4-month interval. These groups include highest risk healthcare workers, designated essential caregivers in congregate settings for seniors, dialysis patients, and all Indigenous peoples and their household members. The system will ensure that their second dose appointment will not be sooner than the minimum of 28 days. If a person needs to rebook their appointment, they will have the ability to select a different eligibility group, understanding that many people fit into more than one group. This is possible, however, only by calling Access Halton at 311. Lastly, individuals will be able to cancel their appointments online instead of having to call 311 to cancel. Canceled appointments are automatically added back into the system and become available for another person to book. Even appointments canceled on the day of that appointment will become available for another person to book as last-minute or same-day appointments. This is an incredible function, which I think will go a long way to supporting the increased vaccine rates in Halton. These new features will give residents the ability to manage their appointments better, and we expect will result in reduced call volumes to access Halton going forward. Next slide, please. We have a comprehensive and diverse approach to getting good vaccine coverage in Halton. We have different clinic models happening in different settings. For example, traditional clinic models occur at hospitals, pharmacies, and primary care settings. In a traditional model, the client comes to the immunizer. There's usually a table with a computer and chairs for immunizers and clients. Once immunized, the client goes to a different area for their 15 minutes of recovery time. In our community-based clinics, we have used what's called a coffee cart model with a mobile cart of supplies so the immunizer comes to the client. This has allowed us to have the client sit in the chair for the entire period of immunization and recovery, being a very good option for seniors and those with mobility issues. This coffee cart model is now being enhanced with a pod model. Physical barriers forming pods to separate clients allow us to maximize the spaces we have at our clinic. The pod model is anticipated to increase efficiency and vaccinate higher volumes of people. Those who received their first dose at a clinic using the coffee cart model may receive their second dose at a clinic using the pod model. Residents will notice that they spend a little bit less time with the immunizer in the pod model. However, every effort has been made to ensure quality of the care that is being provided and that the experience for our residents and others attending our clinics is a friendly one. I'd also like to mention that we have worked with partners to provide mobile on-site clinics for long-term care homes, retirement homes, high-risk congregate settings, correctional facilities, and now first doses with homebound residents. We also looked at our local data and determined that it was critical to offer mobile on-site clinics to prioritize food manufacturing and agricultural workers, many of whom include temporary foreign workers. We have vaccinated approximately 2,200 workers at workplaces in Halton through our paramedic mobile teams. Next slide, please. You'll remember this graph from last month's council meeting showing our clinic capacity in the month of April. We had clinic capacity for 7,200 appointments per day, and we were averaging 3,000 appointments per day at that time. The discrepancy was largely due to vaccine supply constraints. Next slide, please. This graph shows our clinic capacity in May. Since April, we have increased our capacity from 7,200 to 8,300, and our average daily appointments from 3,000 to 3,750. We have increased our capacity by looking at efficiencies in our current clinics. While our vaccine supply also increased from April to May, we still have more capacity and will be able to handle the volume of supply that is coming over the next several weeks. Our supply of Pfizer in the province is relatively stable now. However, while the supply of Moderna is anticipated to increase over the coming months, it continues to be unpredictable in its timing. We carefully manage appointment schedules based on supply allocated by the province. We continue to work with the province to ensure vaccine supply is made available for all Halton residents who are eligible and wish to be vaccinated. At this point in time, we are fully booked for the rest of the month of May based on our allocations, but appointments are available in the month of June for eligible residents. Next slide, please. Overall, Halton has made great strides in rolling out the COVID-19 vaccine. As of end of day on May the 17th, over 265,000 doses of COVID-19 vaccine had been administered in Halton. The majority were administered through community and hospital-based clinics, and then another over 20,000 doses have been administered by our Halton Region Public Health and Paramedic mobile teams at diverse settings throughout the region. Another 37,000 doses have been given by pharmacies and physicians' offices in Halton. The pace has been high. As of April 17th, 1 month earlier, only 141,000 doses had been administered in Halton, meaning the number has nearly doubled just in the past month. Next slide, please. We have made significant progress, but it is important to remember that full vaccine coverage is not yet widespread. As of May the 17th, 54% of the Halton population aged 18 and over has had at least one dose, which does provide very good protection. But this percentage varies widely by age, as shown in the graph on the right. One dose uptake is highest among residents aged 75 to 79, with 89% of these residents having had at least one dose, and is lowest among residents aged 18 to 24, with only 23% of residents in this age group having had at least one dose so far. This, of course, is largely due to the rollout starting with older adults who are at greatest risk for severe illness and death due to COVID. We expect the numbers will rise in the younger populations over the next month as they are now eligible for vaccine appointments. It is critical in the meantime that everyone continue to follow public health measures until we are able to achieve widespread two-dose vaccine coverage. Next slide, please. Halton is on track to offer a first dose of vaccine to 65% of Halton adults by the end of May, a goal identified by the province. The blue bars indicate the number and percentage of Halton residents who have already received at least one dose of a COVID-19 vaccine, while the bars in green represent the number of people we project will receive a first dose by the end of the month based on supply projections allocated to us from the province. Next slide, please. Next, I would like to turn our attention to differences in uptake of the vaccine by location of residence within Halton. The middle column in the table on this slide shows the number of COVID-19 cases per 100,000 people living in each forward sortation area, or FSA, in Halton, which is the unit of geography the province has used to identify hotspot areas in the province. These are cumulative incidence numbers representing the COVID-19 case experience in that FSA to date during the pandemic. The highest cumulative incidence is in L9E, which is in Milton, the only designated hotspot identified for Halton by the province. However, L9T in Milton is also not far behind. The column on the far right shows the percentage of the population in each FSA determined to have received at least one dose of vaccine by May the 17th. The most recent estimate of 51% for L9E and 45% of L9T suggests that more work may remain to be done to reach the residents in Milton, with one dose uptake lagging slightly behind compared to some other areas of Halton. Next slide, please. Now that eligibility is open to all, we are working with the residents in these FSAs to level up first doses. This graph shows that there has already been a sharp increase in the percentage of L9E residents with at least one dose in recent weeks, with uptake rising in less than a month from 20% on May the 1st to 51% on May the 17th. Recently, Ministry of Health officials reached out to us. As compared with many other hotspots in Ontario, L9E's vaccination rates have started getting much better. We believe at this time, this is in part due to increasing access through having a community clinic located in this area, increasing appointment availability, and providing evening appointments through our community clinic that work better for those who cannot work from home, dropping the age eligibility in this area faster than in the rest of Halton, and some specific community partner outreach that we have begun. Next slide, please. A targeted communications plan has been developed by our team for the L9E area, including media releases, community leader updates and toolkits, social media messages, e-blasts to residents subscribing to our vaccine email list, and emails to local healthcare providers. Fact sheets are also going to be available in multiple languages, and there are road signs in particular neighborhoods. We have also launched a video testimonial campaign and are recruiting trusted community leaders in Milton to share messages about the importance of COVID-19 vaccination. As we continue to develop initiatives to address vaccine hesitancy, Halton Region Public Health is also actively engaging with community partners to better understand populations hardest hit by COVID-19 and the unique challenges that might be contributing to vaccine hesitancy or lower vaccine uptake. We have heard valuable feedback and are making plans to take action. We are dedicated to ensuring that our priority populations have equitable access to COVID-19 vaccines. Next slide, please. Vaccine hesitancy is not unique to certain neighborhoods, and I'd like to provide an update on our efforts to combat vaccine hesitancy and increase vaccine confidence in other areas of the region. Halton Region Public Health is launching several initiatives to increase COVID-19 vaccination rates among identified Halton populations who may be vaccine hesitant by highlighting that the benefits of vaccination outweigh potential risks, reducing barriers, increasing access to vaccines, and building community capacity for vaccine promotion. One such initiative involves long-term care homes in Halton. Halton Region Public Health has partnered with our long-term care facilities to create a targeted communications toolkit for addressing vaccine hesitancy among long-term care home staff. The toolkit provides approaches and resources proven effective in reaching vaccine hesitant staff. Some examples of resources found in the toolkit include fact sheets, newsletter and email content, vaccination confidence messages, and guidance on how to recruit and engage trusted messengers to promote and provide information about the benefits of vaccination. We have received positive feedback on the toolkit so far. Homes are using it and reporting increased vaccine uptake among staff working in their homes. This is great news. We have also included long-term care staff in the video testimonial campaign mentioned earlier, and also are planning to host a question and answer session for long-term care home staff with our Associate Medical Officer of Health, Dr. Joanna Oda. We are committed to working with Halton long-term care homes to support their efforts to get staff members vaccinated and are also planning to share this toolkit with our hospital partners. Next slide, please. This past Friday, the federal government released this framework that describes the transition to life after we have good vaccine coverage. While this is very encouraging information, I would just like to note that Halton will be guided by any forthcoming provincial direction. This spring, we know our cases are still high, and while our vaccine coverage is improving, it is still considered low. This means it is critical to stay home, stay safe, and get vaccinated. These are proven strategies that reduce the spread of COVID-19. This summer, if cases are low and vaccine coverage is high for one dose and increasing for second dose, then restrictions could lift for small outdoor gatherings with family and friends. Public health measures of physical distancing and wearing a mask would still apply. This fall, if cases are low and two-dose vaccine coverage is high, then we would be better positioned to do more indoor activities with people outside our household. Some public health measures would still likely need to be followed. Next slide, please. And with that, I will end the presentation. Thank you for your time and attention today.